I'm Johanna Derlega, publisher of The Hill, and I'd like to welcome you to this morning's briefing, The State of Mental Health Care, Challenges and Solutions. Today's event is underwritten by Janssen Pharmaceuticals with support from the National Council for Behavioral Health, and we thank them for making this event possible. We are here this morning to examine the state of mental health care at the national and local level, and to ask what more needs to be done to close the gaps that exist. The statistics are staggering. About 1 in 5 Americans suffer from mental illness every year, but less than half receive treatment, costing the country more than $190 billion annually in lost earnings. Now, as the nation's health care bill and law hangs in the balance, what will the future hold for those suffering from mental illness? This morning, we will hear from federal and state leaders, health experts, and caregivers on mental health policy and its impact on patients and caregivers. Before we get started, just a few notes of housekeeping. In addition to those of you here in the studio, we will be live streaming on thehill.com. We ask that you keep your phones on silent, but we encourage you to join the discussion on social media. You can follow us on Twitter at The Hill Events, and you can comment using the hashtag StateOfMH. We're going to be taking questions throughout the program, so please do keep an eye out for those on my team that have handheld mics. And finally, there is a short survey on your chairs. We would really appreciate the feedback, so if you could fill those out at the end of the program, you can give those to a member of the staff. Before we get underway, I'd like to invite Linda Rosenberg, President and CEO of the National Council for Behavioral Health, for brief remarks.
Thank you. Thanks so much. And thanks to all of you for being here. Certainly a special thanks to Janssen, our partner in this event, and also obviously to The Hill. Also want to acknowledge 2 people from the National Council who've helped put this together, Rebecca Farley-David and Joy Burwell. Thank you so very much. If we had been gathered here less than a year ago, we would have looked and celebrated the progress we had made so far. We would have been talking about the passage of parity, the ACA, the Excellence Act, CARA, and cures. But this past year, in 2017, we've been faced with a very different reality. We've been fighting the prospect of skinny, cheap health insurance plans for the healthy and young, while those who are older and sicker face unaffordable premiums, deductibles, and copays. We've been fighting off the prospect of states forced to balance their budgets deciding who will be eligible for Medicaid: the elderly, the disabled, children. States forced to decide what their Medicaid plans will cover: chemotherapy, transplants, mental health and addiction services. And states slashing Medicaid rates so severely that centers close their doors, staff are laid off, and patients lose their services. The 18th century philosopher Edmund Burke said the only thing necessary for evil to triumph is for good men and women to do nothing. For families and patients, for advocates, for NAMI and MHA and APA, the Treatment Advocacy Center, NACBID, doing nothing was not an option. We may have a reprieve today, but the battle for health care as a right rather than a privilege is not over. But now we're going to take a deep breath, and we're going to again look toward progress. We're going to acknowledge the suffering and pain of those who've not received adequate care, but we're also going to look at what is working and what can work. We're going to hear from Representative Leonard Lance, who believes that CCBHCs offer the possibility of the services people need and want. We're going to hear from Dennis Hobbs, whose McClendon Center is the safety net here in DC. And we'll hear from Fred Osher, who knows that jails filled with people with mental illnesses is our shame and that we must and can do better. We want you to leave here with hope and with the will to fight another day.